The Ambulight PDT multi-device is a light source for use in photodynamic therapy. It is intended to be worn on the skin and to be used in combination with a topical pharmaceutical. The Ambulight PDT Multi is a device that comes in two parts. The first is a single flexible light-emitting treatment head, and the second is a reusable controller. The device emits red light at a wavelength of 640 nanometers, just as with existing light sources. It also delivers a light dose of 75 joules per square centimetre. Where the Ambulight PDT multi-device is slightly different to conventional light sources is that it emits light at 1/10 the brightness for 10 times as long. This leads to a much gentler treatment than conventional PDT, while still retaining the efficacy of existing light sources. Each Ambulight PDT multi-treatment head has an emitting area that is 30 millimeters in diameter. However, it should only be used with lesions which have a maximum diameter of 24 millimeters at their widest point. In every Ambulight PDT multi-controller box, you will find the following materials: the multi-controller, an instruction manual, and a charger for the multi-controller. In every Ambulight PDT multi-treatment head box, you will find the following materials: 10 multi-treatment heads, 10 alignment templates for positioning the treatment head correctly over the lesion, and 1 instruction leaflet. In order to perform a treatment using the Ambulight PDT multi-device, you need to ensure that the device is fully charged. Refer to user manual for more details. The first charge when you receive your device will take 24 hours. Each charge after that will take 3 to 4 hours. You will also need the following materials that are not included in the box: a transparent occlusive dressing that is at least 3 centimeters by 3 centimeters in diameter. This dressing must let at least 90% of light through it. A dressing such as Tegaderm is ideal. A curette for debriding the lesion before treatment. A pen or skin marker for positioning the device. A topical pharmaceutical, and a dressing that blocks light for covering the lesion after the treatment. Before preparing the lesion, the position and orientation of the light source on the skin should be determined. The location of the lesion should also be checked against the permitted locations, as described in the instruction manual. The alignment template should be placed on the skin over the lesion and aligned such that the lesion sits in the middle of the circle on the template. The lesion should be no greater than 24 millimeters in diameter at its widest point and fit completely within the circle of the template. For lesions that are located on curved body surfaces, the template should be rotated round the lesion such that the hinge of the device allows it to bend round the body curve. Dots or lines should be made on the skin using a pen to illustrate the location of the template over the lesion. Once the alignment marks have been made on the patient, the lesion surface should be prepared to remove scales and crusts and roughen the surface of the lesions. Please refer to the instructions that were included with the pharmaceutical for details of how this should be achieved. The pharmaceutical should be applied in an even 1 millimeter thick layer across the extent of the lesion. This will ensure that the pharmaceutical will be absorbed into the skin and become transparent before the light source is activated. Once the pharmaceutical has been applied to the lesion, the entire area should be covered with the transparent occlusive dressing. This dressing should have dimensions of at least 3 cm by 3 cm. Slight pressure should then be applied to the area to ensure that a 1 mm thick continuous layer of pharmaceutical covers the lesion. Once the transparent occlusive dressing is in place, the controller should be secured to the patient via the belt clip. One side of the adhesive liner on the treatment head plaster should be unpeeled to expose the adhesive. The side that retains the liner should be placed over the lesion and occlusive dressing layer and moved around until the device aligns with the measurements that were made on the skin. The entire device should then be placed in contact with the skin and the second liner removed. Finally, the entire plaster should be gently pressed onto the skin to check that it is in good contact with the skin. It should be noted that the pharmaceutical, the transparent dressing and the light source are applied at the same time. Once attached, the controller should be activated. Please refer to the instructions for further details on how to operate the controller. The controller has 2 modes: automatic mode and manual mode. In automatic mode, the device controller is programmed so that the light source in the treatment head will not come on until 3 hours after the battery pack has initially activated. This 3-hour pause allows the pharmaceutical to be absorbed into the skin. After 3 hours, the pharmaceutical will have been absorbed into the skin and converted into a light-sensitive compound. At this point, the light source will turn itself on and illuminate the pharmaceutical and the lesion. The light in the treatment head will continue to illuminate the lesion for 3 hours. At the end of this time, the device will automatically switch itself off. This means that the patient must wear the device for a total of 6 hours. At the end of the treatment, the controller will display the word END. The treatment head, controller and the occlusive dressing may now be removed. It should be noted that although the device is entirely ambulatory and allows the patient to leave the clinic, the clinician performing the treatment must make a clinical judgment as to the competency of the patient to comply with the treatment. This should include an analysis of whether the patient will understand the treatment and whether they will also understand the need to remove the device only after the treatment has completed. The analysis should also look at the physical ability of the patient so that they can read the screen on the controller, reach the plaster and have the strength to remove the plaster. If the patient does leave the clinic, they should take the carry case with them. This will allow them to store the device after the treatment has completed and will protect it until it has been returned to the clinic. The clinician should retain the charging unit. Once the treatment head has been removed, the areas should be carefully wiped to remove any excess pharmaceutical from the skin. A dressing that blocks light should then be applied to the treatment site and left in place for 24 hours. The controller and the treatment heads should be carefully placed in the carry case. For further instructions relating to the post-treatment handling of the lesion, please refer to the instructions included with the pharmaceutical. The device should be returned to the clinic using the carry case that is supplied with the controller. It should be noted that multiple lesions may be treated during the same treatment session. However, each lesion must be treated with a different treatment head. The controller has 3 ports for up to 3 lesions to be treated at the same session. If there is an issue with the device during the treatment, the controller will display the word error. In this case, the patient and/or healthcare professional should consult the pharmaceutical instructions to determine how to proceed in the event of a missed or under-treatment. If the Ambulight PDT multi becomes detached from the user during use, then patients and clinicians should not look at the light source for extended periods of time. The Ambulight PDT multi is intended to be used in combination with a pharmaceutical. Please refer to the instructions accompanying the pharmaceutical for a list of contraindications. Patients with a history of photosensitivity should not use the Ambulight PDT multi. For a full list of locations where the device should not be used, please refer to the Treatment Location Restrictions section of the instruction manual included with each product.